I'm Al McFarland, and I'm glad to be here today at Sanctuary Covenant Church in North Minneapolis, presenting the last in a series of town hall and mass meetings, community organizations and churches working together to create a platform for engagement and information around affordable health insurance. We've been working for the past month diligently getting the word out, collaborating with other media, my company, McFarland Media, Urban Mass Media Group, other social media platforms, all supporting the important work of legacy organizations like the Urban League, like North Point, and church organizations like His Works United, part of the Stair Step Foundation initiative, all working together to take an important story to our community that now is the time to get affordable health care, to get insurance. There's a deadline coming up. March 31 is when people have to sign up. But really, what we're doing is simply beginning to create awareness in our community so that beyond this first deadline, there still is both opportunity and a way to respond to the need for getting affordable health care insurance. So we thank Sanctuary, we thank the community, we thank our partners for working together, for being committed to support this idea that all of us in our community should have insurance. Now is the time. Stay tuned. Keep reading Insight News. Keep listening to WRNB Radio. Keep watching Comcast Channel 937, BMA Networks. Important information bringing us together, showing us what we can do together to create community, to solve a problem, and to build community to get our families and our personal lives towards better and affordable health insurance. I'm pleased to introduce one of the MNsure executives. Mario Vargas is in charge of community outreach and has worked with the communities of color to make sure that we get a message and a connection so that our people get the right information so that we can buy affordable health insurance through the MNsure Health Market, the health exchange. Mario Vargas.
Good morning, everybody. Thank you for coming today. My name is Mario Vargas, and I work for MNsure. I do outreach for the agency, and I'm here today thanks to a group of wonderful individuals who invited us to come and share information with the community about the insurance marketplace here in Minnesota called MNsure. I wanted to quickly just thank Pete Rhodes from BMA for being a part of this process and taping and sharing with the community widely. Al McFarland with McFarland Media Interests, and of course our navigating partner and community outreach partner, Stair Step and His Works Ministries Foundation. So today really we're here to once again highlight the importance of the marketplace. We are nearing the deadline here of March 31st. It's a deadline that we emphasize because if you do not qualify for public health programs, you will have to purchase in the open market, and that means that you'll have to purchase by the 31st. So we call it the consumer QHP deadline, March 31st, and want to emphasize that we want to make sure that if you have friends, family members, acquaintances, your neighbors who you know don't qualify for public health programs, they must enroll through MNsure. However, if they do qualify for public health programs, and we won't know until we invite them to participate and go to MNsure, if they do qualify for public health programs like medical assistance or Minnesota Care, they are more than welcome to partake of our services year-round after March 31st. So once again, just a reminder for everybody, those here today and those sitting at home, that MNsure is the new marketplace through which you can acquire quality and affordable health care. This is new. This is part of the Affordable Care Act. We are a provision of it, and but in Minnesota, it's been in the works for a while. Minnesotans are very progressive in the sense that we want to make sure that everybody gets the coverage and has access to the healthcare system, the wonderful healthcare system that the state has to offer. However, we recognize that it has not reached everybody equally. We recognize gaps. We recognize the fact that there are health disparities, And through MNsure, we hope to close some of those gap disparities. We want everybody covered, and we want to make sure that outreach is accessible, that is out there tapping the shoulders of folks who may otherwise fall through the cracks and not get access to information to be able to acquire that quality, affordable health care. So MNsure, the marketplace, provides a place where folks can easily compare from a variety of plans, easily compare from a variety of choices and value. You can select from a variety of different plans that meet your needs, your family's needs, but we're also here for small businesses. If you are a small business owner with employees from 2 to 50 employees, you're able to go to the marketplace and select a plan that is right for you and your business. So it is the only place where you can qualify for some tax credits and check to see if you qualify for a free or subsidized health plan. So we talk about a variety of different benefits, and I'll just quickly go through a couple of them. Through the Affordable Care Act, through the marketplace, individuals will no longer be denied or charged a higher premium because of their medical history. There are no annual or lifetime benefits on coverage, and there are no exclusions or waiting periods on medical plans for individuals with pre-existing health conditions. You also qualify for a variety of different benefits that prior to the Affordable Care Act you could not. For example, health plans who participate in MNsure must take care of quality benefits for you and take care of those for you. Hospitalizations, ambulatory services, lab services. A very important one for many of our community members who are planning to have children, maternity and newborn care, which covers pregnancy, childbirth, breastfeeding support, pediatric, dental, and vision, to name a few. At no cost to individuals participating in MNsure, through MNsure, are preventative services. That includes vaccinations and flu shots, blood pressure, diabetes screenings, cancer screenings, mammograms, and colonoscopies. So again, we are nearing the March 31st deadline, and it's important for those folks who are may be able to qualify for tax credit to understand that this is a time for you to go. Log on to www.mnsure.org, visit a navigator. You can go on the website, you can call the toll-free center to find a navigator near you. But only through MNsure can you get a tax credit to be able to make that insurance premium a little bit more affordable for you, yourself, your business, your family. So tax credits are available for folks, individuals making up to about $46,000 a year, and for a family of 4 up to about a little over $94,000 a year. There may be some cost sharing reduction depending on how much you make, and so we want to emphasize that in addition to the tax credits, you may be able to qualify for some cost sharing reduction. For example, when you pay your co-pays or deductibles or co-insurance. Through MNsure, you will know if you qualify for a public health program that 100% subsidizes your costs, or partially and to a great extent subsidizes your costs for medical insurance. These programs, of course, as we know them, is medical assistance or Medicaid or Minnesota Care. I want to highlight some benefits as far as medical assistance and Minnesota Care are concerned. Premiums can be as low as $21 a month, depending on your income. We want to make sure that people understand that in Minnesota, because the community of lawmakers, the community of advocates, the state has really pushed to really make sure that everyone is covered. Qualification has been expanded and made simpler for Minnesotans. And of course, through MNsure is how you know if you qualify. The benefits are comparable to private insurance, what you would get out in the commercial market, and may include some additional services like transportation. You can get information through your county or a local nonprofit, so we encourage you to reach out to us, go on the website, call our toll-free center to find out where you can get more information on these public health programs. So while you can no longer be medically underwritten, as we say, there are some factors that will affect the health premium that you may qualify for. If you're taking advantage and applying as an individual or family, where you live, your geographic area, your age, and whether you smoke. So to get covered, it's a very simple process. It involves you going online or visiting with a navigator local to you that will help you create an online account, feed some information into the system. Either you do it or the navigator does it for you. This is some very personal information. We always encourage you to have your Social Security information, your last filings, tax information. Make sure that you know who is living in your household. To get more information about the information that you need, you can go ahead and log on to www.MNsure.org. Once the system has taken all the information that it needs from you, it'll process it and it'll give you a sense of what you will pay, and if there is a reduction, if there is a tax credit that you may be able to qualify for. That takes you to helping you to identify a plan. If you don't qualify for medical assistance or a public health program, then you're able to complete the application. Again, we encourage you, if you are in need of some assistance, if you are computer savvy, but with this process, even the most computer savvy individuals may find themselves in a little bit of a rut, may need to talk to somebody, to talk to a navigator. Make sure that you reach out to Stair Step and a variety of other Pilot Health Center locally, the Urban League, and a variety of other entities that are able to help you in person navigate the system. So with that, I'm going to go ahead and open it up to maybe questions. Again, we have this impending deadline of March 31st, and we want to make sure that you have the information that you need and the assistance that you need to be able to motivate yourself or your family and friends to come to MNsure and try to get your health insurance coverage.
If people have coverage, can they use MNsure to compare and find better deals?
Sure. Thank you.
Is that happening? What do you think?
That is a great question. So MNsure is not just for folks who do not currently have insurance. It's also for individuals who have it but may be paying too much, feel that they may be paying too much, or they may not be getting what they need and want out of their current coverage. So even if you do have it currently, you could call MNsure to find out if maybe there's a better option for you.
Is it true that people will be assessed a charge if they don't apply for MNsure and they're eligible to apply for it?
That is correct. And so one of the reasons why we are pushing and encouraging individuals to get signed up before the 31st is there is a penalty of $95 or 1% of your taxable income, whichever is greatest. And so we want to make sure that the community understands that if you don't get covered, you're gonna lose out. The next time that you'll be able to get covered in and out of the marketplace will be November 15th at the end of the year. However, if there is a life-altering experience, situation that you went through that got you to lose your coverage here these last couple of months, we encourage you to call MNsure to see if you qualify, if your event qualifies as a life-changing event that would allow you to purchase through the marketplace, MNsure.
So if a person earns around $30,000 and they didn't apply for MNsure or insurance by the deadline, how much money are they looking at as a penalty? What do you think?
So it would be about $300.
Okay.
And so you wouldn't feel the impact until the following year when you file your taxes for that year, the year before. So so it makes a difference. $15,000, that's $150. It makes a difference when at the end of the year you're counting on some of that money to work on some projects and you won't have it. So we really encourage folks to try to meet the deadline. Again, I want to emphasize the website, www.MNsure.org. The toll-free number is 1-855-366-7873. The contact center is open Monday through Saturday. And so we really want to encourage you to send folks who you may suspect they may not have health insurance. Not having health insurance for some folks is something that they don't share at the dinner table. So it does take some investigating to do, and some probing and prodding and encouraging. So we really encourage you to help us. Thank you again to our partners, and have a wonderful day.
In the state of Minnesota, African American people represent 17% of the uninsured. That's a disproportionate number in respect to our presence in the population. Why are African Americans such a high rate of the uninsured? We think that the answer isn't simply a matter of you need applications available and brokers to talk to you. We think that there's some cultural issues. Because we thought that so deeply, we provided then a connectivity to the issues, the cultural issues that cause African Americans to be less insured than we ought to be. And so in the video that you're about to see, you'll actually understand some of those issues and our response to it. As a result, we want all African Americans to become insured because we recognize it's in our best interests. The video is called Discover Truth, and it speaks to the history of the development of imaginative responses to economic crisis in our community, and the powerful work of the first African American president in bringing forward the Affordable Care Act. We've had a series of these meetings. They've been great. We've had an opportunity working with our church network to actually bring you more and more information. Well, we want to continue that. This doesn't end March 31st. Enrollment for qualified health plans this year will end on the 31st, but many of us will still have the opportunity and the need to be insured in a variety of different ways. Continue to contact StairStep, 612-521-3110. Continue to contact the Urban League. Continue to check in with North Point and other providers. Continue to watch BMA. Continue to read Insight. You'll get the information you need. Let's get it done. For too many of us, our primary health care comes in emergency rooms. Instead of preventive care, we're in catastrophic care. It would be better for the entire society if our community and all those who are the uninsured were to become the insured.
For us, on many plantations, health care was attended to by veterinarians, not by physicians. So there's been a long, deep distrust of health and the care of our people.
But there is a hidden history of African American financial self-reliance, one that offers a reminder of the power, pride, and wealth that grows out of the use of financial services like health care insurance.
We had African American leaders, primarily coming out of our religious community, ministers like Absalom Jones and Richard Allen, who at the end of the 18th century created mutual aid societies. Organizations in which African Americans pool their funds that we might be able to bury our dead, that we might be able to take care of the widows, that we might be able to provide some health care for the youth.
A multi-million-dollar enterprise operated solely by and for Negroes.
Like the mutual aid societies and the bustling black insurance companies hidden in our history, an African American president has brought forward an opportunity for affordable access to health care for all.
I'm not the first president to take up this cause, but I am determined to be the last.
Our people have access to MNsure, an opportunity for health care. We do want all African Americans to be covered. We will assist. We're just grateful to Pastor Dennis Edwards, to our navigator here at Sanctuary, Steve, the great work that's being done here. Thank you for the opportunity to bring this information to our community through Sanctuary Covenant Church.
Okay. Well, I'm Cheryl Anderson, and I'm on staff here at Sanctuary. I'm the office and ministry manager for the church. Sanctuary it's real important for us to be in North Minneapolis. One of the things that we really want to be here for is for community, try and develop a community here in North Minneapolis. And so we planted ourselves right in the middle, and we were trying to reach out. A lot of things started back with the tornado, and this community was hit really hard with tornado. And so the next day of the tornado, we started a feeding program out here where we set up grills and fed probably 200 to 300 people a night. And so that was our main outreach into the community, and since then we've been trying to find ways to keep connected with the community. Our pastor one day, a few months back, said, you know, it would be great if we could do something with MNsure and let people in our community know how they can connect. Steve Leonards, our navigator here, took that call up and said, hey, I'm willing to get involved. I'm willing to go through the training and become a navigator. And we just saw it as another way to connect with our community, to be out there and just let them know, hey, we're here and we want to be here and we want to help you as much as we can. Well, so far I think it's been great. We actually had people coming in before 1 o'clock, which was kind of awesome. I was, as I was pulling up, I saw people pulling up, and so I was like, oh, this is really going to be good. So I'm excited. I'm just being able to connect with people. We decided to do food today just to make it a little bit more fun and just to have a good time. Well, I think it's really important. We have to have insurance now. You do get penalized if you don't have insurance. And even if you do have insurance and you think you might be paying a little bit too much, check out the MNsure program, because you can find some real affordable insurance. It's important, if you have insurance, you can do preventative care rather than waiting until you've got a catastrophic event going on and having to go in, and it's a lot more costly for you. So I think it's just important to stay healthy and get that preventative care. We've had some great experiences with people who haven't thought that they could afford insurance, who have come in and found out that they really can, or that they don't even have to pay for it, that they can get insurance for free. People who have just been delaying care, and they come in and find out that they can really get insurance and get care, and it's just been exciting, yeah, to see.
I'm Victoria. I just moved back here to Minnesota. I was in Florida, going to school there, and now I'm here. It's cold. I had health insurance previously through Blue Cross Blue Shield, and the health plan that I had got discontinued because it didn't meet the coverage requirements of the new healthcare system. So they discontinued it, and so I'm here to get new health insurance. It's important to have health insurance in case of emergencies if something happened. Plus, my parents don't nag me if I have it. Actually, I came to see if I qualify to get assistance because I don't have a job, so I don't make any money. And so I thought maybe if I came here and talked to somebody, I could figure out how to do that kind of stuff because I've never done it before. I've never applied for any kind of assistance before, so I figured if I came here, maybe they could help explain things for me. I tried doing it online, and it's pretty complicated. And I tried to sign up for the thing, and then after I got my username and password, it wouldn't really let me log in and apply for a plan. Plus, then when you do find the plans, there's a whole bunch of plans with all these different options, and I have no idea what they mean. Well, I'm hoping the navigator can help explain to me what the different coverages that they offer and what is what and what's the best fit for me. I would share with my friends and let them know how easy it was to come down here and fill out the paperwork and talk to somebody. I think that everybody should take advantage of the opportunity to come here and talk to somebody and figure out what they might be able to receive that's better than what they're getting now, if anything.
My name is Angelique Kingsbury, and I am the social media coordinator for McFarland Media in conjunction with helping MNsure get out the word to our community about the importance of enrolling in MNsure and what's available to us as a community. It's been very exciting to just get out and use all of our social media outlets, Facebook, Twitter, Instagram, using our websites to draw people in and share the importance of being enrolled in MNsure and what we have available to us. We definitely need to use social media as an outlet because so many people spend their time online. That's where we connect. That's where we have our conversations. Well, we have definitely sent out an invite of all of our events that have occurred throughout the month of March. Your direct contact would be insightnews.com, and you can also go to Insight News, the fan page on Facebook. You can also find us at Insight News on Twitter and Insight News Pics on Instagram. And another place, of course, the main place you'll find the videos are the BMA network, which is channel 937 on Comcast. Oh, I think social media, I mean, is a great way to connect with people. That's where a large part of our audience comes together. They have time, they sit down, they log on to their social media sites and they exchange information. You'll find videos there of different representatives such as Senator Jeff Hayden or the CEO of North Point, Stella Whitney West, our Ramsey County Commissioner Tony Carter, and many other individuals who have come together to voice their enthusiasm or encouragement collectively to say, hey, this is available to us. We need to take advantage. We need to be accountable. Our health is our wealth, and come together as a community to mobilize around this. It's exciting for me because I feel like personally it is our responsibility to our loved ones and to ourselves to invest in ourselves. And the best way that you can invest in yourself is by taking care of your physical well-being. And up until now, some of us haven't really been able to do that because of the lack of health insurance or coverage available to us. Now is the time to step up, to take accountability for yourself, get enrolled, and also play it forward and pass that information on to the people that you love and that you care about, because it's very clear that healthy communities are more powerful. You know, it's definitely linked to our success. So why wouldn't we want to be successful? Why wouldn't we want to invest in ourselves? And I guess that's my enthusiasm and my love for the community and the people that I care about. And so I enjoy being online and getting that information out and sharing the word. And I encourage you to do that too. The last thing that I would say is if you have time to get on Facebook, Twitter, Instagram, Google+, if you are online and you are surfing and doing other things, then you have time to log on to the MNsure website and make sure that you're enrolled. You have time to seek out that information and find out what it is that you need to do. And we have navigators available to you. They're here, they're waiting for you. There's 20 of them. They're trained and they're ready to go to get you set up and get the coverage you need.